Parathyroid hormones. So parathyroid hormones are secreted by the parathyroid gland, which are actually located, so they're tiny little dots located on the thyroid glands. And so anyway, so parathyroid hormones are basically released as a response to low serum calcium levels or low blood calcium levels. So what happens is once this is released, it causes the reabsorption of calcium. So basically the body is taking calcium from the bone, and so that it can be present in the serum or blood, and so it can be available in the circulation. And so in addition to that, it also causes the excretion of phosphorus, typically through the kidneys. And so knowing that, right, we have to remember that calcium and phosphorus have an inverse relationship. So whenever you have a low calcium levels, phosphorus will go up, and so vice versa, when you have high calcium levels, phosphorus levels will go down. Anyhow, so parathyroid hormones causes an increase in serum calcium levels. So in patients with hypoparathyroidism, you will see that their calcium levels are going to be low. So hypoparathyroidism is basically a condition wherein a patient does not have enough parathyroid hormones or PTH, which leads to hypocalcemia. And so knowing that it has an inverse relationship with phosphorus, we know that it will cause hyperphosphatemia. So signs and symptoms of hypoparathyroidism would be the signs and symptoms of low calcium levels, which include tetany, numbness, osteoporosis, positive for chopsticks and trousseau. So these are reflexes present in low calcium levels. So chopsticks is basically like the twitching of the face, and trousseau is the flexion of the arms because of the low levels of calcium. And so so how do we treat low calcium levels, or basically hypoparathyroidism causing low calcium levels? Well, if we know that we have low calcium levels, right, then we have to treat them with calcium supplements in addition to vitamin D. And definitely part of our responsibility is to examine the patient and take note of the signs and symptoms of hypocalcemia as well as hypercalcemia, right? So hypocalcemia, basically the signs and symptoms of the disease, but knowing that we're going to give those supplements, we have to also examine the patient and keep an eye just in case they develop hypercalcemia. The opposite of hypoparathyroidism is hyperparathyroidism. So hyperparathyroidism is basically the condition wherein a patient has too much PTH or parathyroid hormones. So that causes an increase in calcium levels. So again, knowing that it has an inverse relationship with phosphate levels, we know that a patient with hyperparathyroidism will have hypercalcemia. Therefore, the likelihood is that they're going to have low levels of phosphate, which is basically hypophosphatemia. And so signs and symptoms of that can include bone calcification, so calcified bones, and renal calculi or kidney stones. Agents that we use to treat hyperparathyroidism are basically medications that can cause a decrease in calcium levels in the blood. So one, that would be a hormone, right? Calcitonin. So again, remember that calcitonin is produced by the thyroid gland. Anyhow, but the role of calcitonin is actually to decrease levels of calcium. So calcitonin is a hormone produced by the thyroid gland, which helps decrease calcium levels. In addition, we can administer a loop diuretic, basically your furosemide, which increases calcium excretion through the kidneys through urination, and so that will help with the symptoms as well. And knowing that, again, phosphate has an inverse relationship with calcium, we can administer phosphorus supplements, which will then help decrease the calcium levels. And one thing that we have to make sure is that if we know that a patient has high calcium levels or hyperparathyroidism, we need to avoid, right, administering thiazide diuretics. And so why is that? Well, thiazide diuretics actually increase serum calcium levels. And so if we know that a patient is, let's say, on hydrochlorothiazide, right, we may need to hold it and clarify with the provider. The likelihood is maybe they didn't know, and so there's usually other alternatives to the thiazide diuretics. And so again, know that thiazide diuretics can increase calcium levels. Therefore, this is contraindicated to patients with hyperparathyroidism. And so last but not the least, right? So knowing that if a patient is on any sort of hormone therapy, regardless of what it is, whether it is for your thyroid or parathyroid or even other types of hormones, right? These are things that we have to really incorporate in our nursing interventions and care plan, right? So we have to basically ensure that we are assessing the patient, right? Making sure that they're receiving the appropriate treatment, that they're experiencing the therapeutic effects. We also need to keep an eye on potential side effects and also assess their knowledge, right? We need to know how much do they know about the drug that they're taking. In addition, patient and family education is very important. We have to educate them regarding the disease, treatment, sick days, right? Especially like for some conditions, right? It can actually affect the levels of their medication or how well their medication will work for them. In addition to that, depending on what type of hormone we're administering, whether it's insulin, thyroid, parathyroid, right? We need to assess for those lab levels. So example is your serum glucose levels or your sugars, potassium, fluid volume status, the thyroid panel, right? Calcium level. So it just depends on which one it is, right? We just need to know which labs are affected by those hormones and conditions. And then one thing that we have to really make sure is that the patient should not ever abruptly discontinue any hormone drugs, especially the thyroid medications. This can be life-threatening because discontinuing thyroid hormone medications abruptly can actually lead to myxedema coma, which is a severely low level of thyroid hormone that can actually affect the patient's heart. So this condition, myxedema coma, if you look at your patient with that condition, they actually have signs and symptoms of heart failure. So again, this is very dangerous, and so we have to ensure that the patients are aware of that and that they're compliant with their medications and they're aware to not abruptly discontinue their treatment. And again, although thyroid hormone is one of those drugs that you shouldn't discontinue abruptly, it's really most or if not all your hormones, right? Because the body needs time to adjust, and if you do something so abrupt like that, it can actually again cause some life-threatening complications and side effects for the patient. Anyway, I hope this helps. Thank you.